Hello, good morning, guys. It's that Pinoy nurse. So, here's my three common test taking strategies to help in the nursing board exams. So, we have first, number one, understand the STEM question. So, what is a STEM question? So, in order for us to understand what a STEM question is, we have to learn the components of a question. So, a board exam most probably is composed of a multiple choice question. So, a question or the entire question is called an item or case, and each item is made up of a stem that asks the question. So, the stem basically is the part of the question or a sentence that is asking the question. Under each stem, you will find your options. Since only one option is correct, the other options are referred to as distractors. So in nursing, especially in the board exam, most of the answers are correct, but you have to find the best answer to be your answer. So we have here, the case is the description of the patient situation, present the scenario of what is happening. The stem is the part of the question that presents the specific question being asked. So distractors are answer choices that are feasible but ultimately incorrect. They do not provide the best answer. So the correct response or the correct answer is the best answer of the question. So here's a sample multiple choice question. A young man is admitted to the emergency room with pain in his right lower quadrant. Acute appendicitis is suspected. Which healthcare provider prescription should the nurse implement first? So the STEM question here is, which healthcare provider prescription should the nurse implement first? So that is basically the question of the statement. Distractors, we have one, administer 5 to 325 milligrams of hydrocodone or acetaminophen PO for pain. Number two, draw blood for complete blood count and electrolyte levels. We have number three, obtain urine specimen or for urinalysis, and the correct answer is number four, start intravenous line with normal saline 100 ml per hour. So as you can see, there's only one correct answer, and the rest are considered as distractors. Okay, so we will get to how to choose the correct answer later. Now, another example. What should the nurse do immediately before performing any procedure? So as you can see, this question is called the item or the case, and the statement that asks the question is the stem, and we have the choices as the options, and we have only one correct answer. So the correct answer here is, what should the nurse do immediately before performing any procedure is hand washing. Okay, hand washing or wash the hands is the correct answer. So letter A, C, and D are considered as distractors. So the STEM question has two types of polarity, or what we call the STEM polarity. We have positive and negative polarity. So what is this? Positive STEM, this type of question is concerned with the truth, a fact, or a principle. So this question basically attempts to determine if you are able to understand, apply, or differentiate correct information. So a positive STEM would make you answer the question correctly, or it will try to assess if you know the correct answer. Okay, so a negative stem, however, is concerned with what is false. So ask a question with a negative statement. So most all negative stem, they are stated in a negative statement, typically uses words like except, not, or never. May use other words like contraindicated, unacceptable, least, or avoid, which requires you to recognize exception to the rule. So those are negative stem type questions. So we have here example of a positive stem. Before performing a procedure, what should the nurse do first? So it's asking what the nurse should do first before performing a procedure. So we have here, the correct answer is explain the procedure to the client. Okay? So letter A, B, and C are considered distractors. Another positive STEM question. We have which intervention is common when caring for all patients with infections? Is it letter A, donning a mask, B, wearing a glove, C, washing the hands, or D, wearing medical gloves? So, which is it? So, the answer here is letter C, washing the hands. So, not all clients with infection would require you to wear masks, gowns, and gloves, but all of the patients with infection will require you to wash the hands. Okay, let's now look at an example for negative STEM question. We have range of motion exercises should not be done. So as you can see, should not be done. So is it A for comatose patient, B on limbs that are paralyzed, C beyond the point of resistance, or D for patients with chronic joint disease? So what's your answer here? This is a negative type STEM question. Which should not be done? The answer is letter C. Okay, beyond the point of resistance. Because if you try to force the range of motion beyond the point of resistance, you have a tendency to break the bone or break the arm or the feet or the joint of the patient. Another negative STEM question is what position is contraindicated for the patient who has dyspnea? So, what position would be contraindicated for the patient who has dyspnea? Is it A, supine, B, high fowlers, C, semi-fowlers, D, orthopedic? So we have here the word contraindicated, meaning this is a negative STEM question. So dyspnea means difficulty of breathing. So the answer here is supine. So a person with difficulty of breathing should not be placed in supine because it will aggravate the status of the patient. Number two, so you have to remember your nursing process. Okay, so we have ADPI, assessment, diagnosis, planning, implementation, and evaluation. So especially in the nursing exams or quizzes or board exam, nursing process is your blueprint for the correct answer. It is your fundamentals, it is your core, and how you try to analyze a question or how you try to approach an answer. You have to remember always your nursing process. So first is always assessment. We have here assessment question. While making rounds, the nurse finds a patient on the floor in the hall. What should the nurse's initial response? So the STEM question here is what should be the nurse's initial response? So we have here the word initial. So is it A, inspect the patient for injury, B, transfer the patient back to bed, C, move the patient to the closest chair, D, report the incident to the nursing supervisor? So what's your answer here? So the best answer would be letter A, inspect the patient for injuries. So you have here your nursing process. So you have to assess if the patient incurred any injury due to the fall. Okay, so assessment first. Next, in the implementation question, the primary nurse assign, assigns a staff nurse to insert an indwelling urinary Foley catheter. What is the first thing that the staff nurse should do? Is it A, explain the procedure to the patient, B, gather all equipment at the bedside, C, check the physician's order, or D, wash hands thoroughly? So what is your answer? We have here, check the physician's order. So you have to check the physician's order. So you have to assess if there is in a doctor's order to verify if you are doing the right procedure to the right patient. So you have to check the physician's order. Third and lastly, you have to prioritize your ABC. ABC, you have airway, breathing, and circulation. So a lot of questions, especially in the nursing board exam, will tend tend to try or let you analyze critically on what situations are important. So we have ABC, airway, breathing, and circulation. So we have here a question. A patient has just returned from surgery with an IV and does not have a gag reflex. Which planned intervention takes priority? Is it A, ensure adequacy of air exchange, observe the dressing for drainage, or letter C, check for infiltration, or letter D, monitor vital signs? So a patient returned from surgery, no gag reflex. STEM question is, which planned intervention takes priority? So the answer here is ensure adequacy of air exchange. You have to remember your ABC. You have to prioritize your airway. Next, which nursing diagnosis has priority among client in the PACU or the post-anesthesia care unit? So is it A, acute pain related to discomfort of wounds and immobility? Letter B, body image disturbance because of wound dressing and drains? C, ineffective airway clearance related to general anesthesia? Or letter D, knowledge deficit related to lack of information because patients are all sedated? So here you have a patient who is in the PACU. So what is the priority? We have letter C. Okay, letter C is the answer. So ineffective airway clearance. So again, ABC. So airway is always the priority. So to recap, we have number one, understand the STEM question. It can either be positive or negative. Number two, remember your nursing process. We have ADPI, assessment, diagnosis, planning, intervention, and evaluation. And number three is prioritize your ABC. So airway, breathing, circulation. Okay? So what's your strategy? Like if you think it was helpful, share if you want to help others, subscribe to stay updated. I will upload similar videos related to this one, and comment and tell me your test taking strategies. Thank you for listening, and I'm that Pinoy nurse. Always stay interested. God bless.